this
And you'll come down right on the other side.
Yeah, really, this is not
So you
good.
can go up and around, but,
Where's Luann? No, nothing.
Okay, call will be to order. We're back at the nursing home. First thing, we need a motion to accept our previous minutes. Kathy, Bob, all in
yes.
favor?
Hi.
Aye.
Opposed? Oh, before, is there anybody on, okay. Okay, Steve.
All right. So we've had our first full month that we were in the new building, which has been amazing. I know you all came out there last time to be able to see kind of what we're working with out there. In the month of September, we had 92 office visits and 21 in our outstations. So this is up to 113 veterans seen in 1 month. And our programs, we had 32 veterans that came in for our programs. This is the PTSD mental health counseling, it's peer-led, as well as we did an event for our Afghanistan veterans that were struggling with how things were turning out with that as well. One thing to note on this is that this is close to, if not one of the top office visits that we've had ever in our office. And we were out for a week due to annual training at the end of September. So things are definitely ramping up at the new space. We're getting more and more people through. And so, yeah, I'm just really excited about it and where we're going to be able to go from here. One thing also, we had a ribbon cutting. We had close to 100 attendants. Many of you were out there, so I do appreciate those kind of board members that did come out there for that ribbon cutting ceremony. And yeah, I wanted to say that the annual training was really good. We learned a lot about combat-related special compensation and combat or concurrent receipt of retirement. So what used to happen back in, I think it was 2003, the law got passed. Military personnel would retire from the military and they'd get out and then they file for disability and then their military retirement would get reduced by the amount of their disability, whereas now they can get concurrent receipt if we follow the proper paperwork and stuff. So just learning the ins and outs of that, as well as their compensation, their pension, kind of the whole gamut, Medicare and how that's working out, and a little bit about Social Security disability. And so really good training down in East Peoria. Had a great turnout, and yeah, can't wait till next year to get back down there and do some more. Any questions, concerns? All right.
Everything going good with the new building?
Yeah, everything's going good. I know you all had asked us to get a few more bids for the camera system and the lock system. We've reached out to multiple companies. We got one person that came back and wanted to do a bid. So we'll probably be moving forward with that here in the near future.
So you're working with the city to approve them? No, is that, you're gonna have?
No, the camera system's gonna be a private company that's gonna come in and install cameras within the system.
But I mean, is the city approved gonna be, the police department gonna be able to, are you gonna have a button that?
So that's what we had talked about last time. So last time we talked, IT can do that with our current phone system. We just need them to have the authorization to do so. So apparently there's equipment and different features that have to be purchased, and we just need them to be able to do that.
So you're getting bids then? Or IT's gonna?
IT apparently is working with their committee to get that, because apparently they want to do that with the whole county.
Oh, okay.
So, yeah.
So I see you got 2 water bills. Is that because there's 2 different parts of that building?
Yeah, so there's 2 different units, so it's 2 separate units.
Okay.
So, yep.
Okay, we need a motion to pay his bills. One is for $1393.78. One is for $350. And hand drawn about $22, $24, $42.
So moved, Mr. Chairman.
Elmer seconds, all in favor?
Aye.
Opposed, motion carries. And then we need a motion to accept Steve's monthly report, place on file. Elmer, Kathy, all in favor?
Aye.
Opposed, motion carries.
Appreciate it, thank you.
Have a good
See you, Steve.
week. Okay, Carrie.
Good one.
Yeah.
The report?
Monthly report.
Okay, the activity department, the new activity director is doing well in her new position. She's very energetic and organized. We look forward to many more activities with her. She's wonderful, she's doing great. I forgot to add, we're doing trunk or treat for our staff. That's where everybody decorates their trunk, and the staff's little ones can go around and get treats, and the residents like watching that. Admissions, unfortunately, we only had one. We had one cancel admission because they ended up having COVID. 2 returned to the community and 0 expired. So we have 3 solid projections right now, or 3 male exec projections and 2 female. We have 6 leads, our average census is 41. Continued referral activities and connections include in-person meetings to all area hospitals in LaSalle County. Special meeting includes St. Anthony Medical Center with Hannah Embry to improve communication with acute care settings. In-person calls to area influencers including Nora Fesco and Amber Knox, alternatives for older adults. An educational event was organized with community care coordinator Mary Fran of alternatives for the older adults as reported last month. LaSalle County Nursing Home coordinated with Mendota Area Senior Services to participate in a social distancing mailing event for LaSalle County seniors. Information was provided at no charge through a mail grant facilitated by Ray Ancestor of Mass. Several inquiries and calls have come in during the month, including 2 married couples from the community. October looks pretty good for admissions. Employee incident reports, there are 2 employee incidents reported for September. An activity aide fell in the dining room as she was walking. She received bruising to both her arms and knees. Another activity aide fell outside before her shift. She was walking in the grass when she reached the sidewalk and she fell. She received bruising to both knees, arms, and a fracture to the left arm. So the total for 2021 is 6. Nursing department, we currently do not have any cases of COVID. We continue to participate in the weekly IDPH webinars for up-to-date COVID-19 and get sirens daily as well. Our current testing protocol is weekly for all unvaccinated staff. This is per the recommendations of IDPH. Only unvaccinated staff will be tested unless we have a positive case that develops. We then initiate our outbreak testing. Outbreak testing is the weekly testing for all staff and residents regardless of their vaccination status for 2 weeks. If no new positives are found, then we resume weekly testing for unvaccinated staff only. There is to be new guidance coming from IDPH on visitation and testing, etc. It has not been released as of this time, but basically what's coming is we're going to have to probably do bi-weekly testing for the unvaccinated. It was put out, it just wasn't put into motion yet. The facility continues to use rapid tests, which are also known as point-of-care tests that are supplied by the federal government and the LaSalle County Health Department. We continue with screening measures to enter the building. All staff visitors are screened before entry into the building at this time as well. All staff are to wear a procedure mask at all times. Masks must be adorned prior to entry and not removed unless eating or within a safe distance from others for a short period of time. During outbreak, PPE is eye protection and N95s. If the county positivity rate goes above 5%, eye protection must be worn by all direct care staff on the resident wings and when in company of residents. Residents continue to be monitored every shift with a full set of vital signs and twice daily temperature and SpO2 monitoring. LaSalle County Nursing Home will continue to ease up restrictions according to IDPH and CDC guidelines. We continue as a team to update policies and if need, create new ones to make sure we are meeting IDPH regulations and mandates. The nursing home has a permanent pharmacist consultant on hand, which we always have, but the pharmacy has been, I don't know if they're having issues, but we kind of had a open door policy type thing where it was always a new one coming in. We have a permanent one now, so that's good. Since the retirement of our long-term consultant Dave, we've had several ones coming in and out. So Sergey is now coming to do consultation remotely and in person. All PCPs are coming in for their rounds, except for our house psychologist. He continues to see residents via telehealth. We've had one resident return home this past month. We admitted a new resident on 9/28. No new hires this month. We have one CNA on medical leave with a return date in late October. We terminated a PM shift CNA with no call, no shows. And she interviewed 2 CNAs for PM shifts. Restorative programs, 37, range of motion, 35, eating programs is 11, dressing and grooming, 29, walk to dine, 11, toileting, 29, for a total of 115 programs. As far as my report, we've had one bid for the food service contract. I met with our attorney and we have agreed we can accept the bid. The current bid is from the same company we currently have. We had a visit from County Health Department. There are 2 areas found that need attention. The food service manager must get a sanitizing certificate as it was expired. There are 2 in the kitchen that do have it, so it's okay, she just needs to get it. The other issue was that a proper air gap was not provided at the wash sinks. We've applied for a variance due to the complexity and cost of it. Now, actually, we haven't yet. I put this down. That's what I need to talk to you guys about. Basically, Mike and Bob, they were talking. They don't know if they should fix it or if we can get a variance. Now, the health department said we can go ahead and apply for a variance. I don't know what that entails. I did send an email out. But if we install the air gap, it's gonna be quite a bit of money, they said. So more than
What's an
likely.
air gap? On a sink?
Basically,
yeah,
the way I understand it, and we've never had an issue before because there's no issue with backup. So apparently the way the drains run, they're saying there's an issue, or there could be an issue where if it backs up, it'll get into the good water supply. Mike and in maintenance said he doesn't see how that could happen because there was a drain there. They said we're out of code, and they sent over the administration code too. So it's either a variance or we fix it. So I'm waiting on Bob to get back. I think they were gonna have a plumber come in and look at it as well.
Okay. Well, we got property meeting Friday, so it's
Yeah. Bob has pictures.
Oh, does he?
Yeah.
Okay, he had took
Yeah, he
pictures.
came in and he was telling me about it.
Okay,
So
good.
he has pictures and stuff like that.
Well, we're on a timeline. We applied for a 14-day waiver, so this will be the last week.
Yeah, the meeting's
The meeting's when?
Friday.
So you'll be out of time,
We're gonna be out of time.
so you need to,
We're gonna have to apply for the variance then.
yeah, apply for the variance, and if Bob finds somebody that can fix it, we'll fix it.
Is this a new thing? A new rule with the health department or?
I don't know if it's ruled, they sent, or if it's new, they sent the administrative code, but it was never found before.
Yeah,
all this,
okay.
Yeah, I don't know.
I still don't understand what this air gap thing.
No.
Still,
There's no way that it should get near the drinking water. Well, I know on like a hydrant, you can get a little thing to put on it that will back siphon.
Well, it's the rinse sinks. So it's like the clean water, the dirty water, and then like the sanitation water. It's those sinks that they're talking about. But Mike said, the way the drain is, there's no way it'll happen, but I'm not sure.
Okay.
And I'm not a plumber, so I can't.
I didn't see the pictures.
Yeah.
So we'll apply for the variance and
Go from there.
go from there. Okay, we continue to struggle to get staff. We're down to 8 CNAs total. And that's all we have to go across the 3 shifts. We are utilizing the agencies we've had, and that still was not enough, so we had to emergency acquire a couple more agencies. So far, we don't have anything from them yet. Hopefully they can get us something soon. And we should talk about increasing these CNA wages. I think, Gary, you and I talked about that. I think that's the best thing. There was an ad put in the paper for a Streeter nursing home, and they went up to $19 an hour. These CNAs are gonna go to other places for that money. I can read over that, my proposal, when I'm done with the report. The state has set out to send us $64,272.20 to aid in reimbursement for staff funding for the months of July, September, and August. There are stipulations on what it's to be used for. First check, 50% must go towards staffing, the second, which should be 62.5%, and the third is 75%. The rest of the money then can be used for PPE and masks and all that stuff. We had to submit a budget and do a signature sheet, and that was due last Thursday or Friday. So basically how we have it figured out is we can use part of that 50, 75, and 62.5% for what we paid an agency. So that will help cover that cost, but the rest of it has to go to direct care, or frontline staff. So no matter what, they have to get that. So whether we do a bonus, however we wanna do it, they have to get that money. Then the rest of the money goes to the nursing home. And that's what we put in here. So we divide it up on how much the staff will get, and then we have to subtract, of course, the agency that we used. And then the rest will go towards nursing. We don't have that money yet. It'll be 3 checks of like $21,000, I think they said.
I was gonna ask.
Yeah, 3 separated checks. Which, I'm surprised we don't have the first one yet, because the first budget proof is due October 30th, which is this month. So we would need to get that money to use it, unless we're gonna use our own and just use it as reimbursement. Either way, it's due
I'd rather wait
30th.
until you got the money before you start handing it out, because they might change their mind.
I know. Agreed. So we'll wait, but then we just have to provide proof on the 30th, just like we did for the CARES money. Basically, it's the same thing. You submit a budget.
Well, have you talked to, payroll? How are they
I
gonna,
talked to Sue and she explained it to me. It just goes into,
she hasn't figured out how to do it then?
yeah, yes.
Okay.
Yeah, so that's figured out. And then I'll have to get with Melissa as well, because I would think she would need to be, and Jeannie, they would all need to be aware. But so far we haven't seen the money. The fire system inspection, it's a 20-year inspection, was done by Cintas. This is on the agenda too. We will need to remove and replace 6 sprinkler heads and butterfly valves. We also have backflow repair that needs done. So this will replace total rubber gaskets on the first, second, 12 valves, or relief valves. This is a mandatory fix. The cost for each service is $4,612 and $4,588. So the total cost for all that is $9,200. He did send out, or he called just to make sure this isn't something that is optional, it's mandatory, and it's the 20-year inspection. We can't not. We have to do it. Then we get into broiler maintenance, will need to be completed. So there's 2 quotes. We're on the 3rd year, which would require the heavy cleaning. For first year, heavy PM preventive maintenance work is $5,360. A 3-year, so it's 1 heavy and 2 normal, is $10,000. So every 3rd year, we have to have the heavy PM done, and the other 2 years is a normal. So we can either do the $10,000 and save money for the 3-year plan, or we go ahead and just do the 1 year, which is gonna cost us the $5,360. But we have to do the heavy maintenance now.
Yeah.
It'll be cheaper to do the $10,000 because
In the long run.
in the long run.
How long is the boilers, when do we put the boilers in?
This is the third, well, the year of the tornado. That was what?
17. 3rd year, yeah.
Well, I know I got 2 boilers, one in my garage and one in my shop, and they would like to do it they come every year and take the front off and just clean it a little bit. But then every 3rd year, you gotta tear it down and put all new gaskets in it and igniters.
This is just preventive maintenance.
Yes,
And there's what, 5 of them down there? Isn't there 5 boilers?
I couldn't tell
Or
you.
4?
I don't know for sure.
I couldn't remember how long they've been in there, I was like. Twice.
Yeah, they're more energy efficient, but you give part of your savings back in maintenance.
So is it $10,000 for all 5 of them?
Yes, total.
Yes. Okay.
Yeah, that would be, for the next 3 years is 10,000.
They,
Okay.
we give them 10,000 now, and that's for the 3-year program.
Right. If we don't, we'll pay 5,000, and then I believe the consecutive years is a little over 3,000. So we'd save a little money. So you wanna go ahead, should we do the 10,000? 3-year?
That's my opinion.
Yeah. Makes sense.
That's the heavy and the 2
Lighter cleanings.
when we get to that point on the agenda.
Okay, there are 2 mandatory integrations with electronic health records coming very quickly. One for the Illinois Prescription Monitoring Program and the other one for state and patient portal, which integrate the state with resident identifiers. Basically, that's for public aid. IT is helping us with these 2. The room rate increase letter went out October 1st for the next year. The state is requiring a new spreadsheet to be updated and submitted quarterly on skilled versus intermediate level of care. It's another program coming out. I'm assuming this will work into our staffing ratios and star ratings as well. It's another way of tracking we have enough staff to take care of our residents. The new state mandate requiring us to be integrated with the state for health records and also the controlled substance program through our electronic health records is underway, but we have until January 1st, 2022 to have it completed. I'm working with IT on all that. The front entrance cleanup has went really well, and we've completed the rock. It looks very nice. We are looking to getting matching metal art pieces for each of the side entryways. Again, this is all donation money we've used. We would like to have a meeting at our nursing home once this is completed, and I'll let everyone know. But we're looking to get a couple art pieces donated as well. Our idea is for all the people who's lost lives during COVID, we want to have some sort of memorial for them, especially in nursing homes. Completes the report.
So what is the state,
Pardon?
what is the state regulations on us having a meeting down there?
I don't know. People can come in if, like, it's mandatory. If family is having, if a resident's having family come in. As far as when I can have you guys come in, I can't tell you that. I really don't know yet, but hopefully soon. I don't mind coming up here, I really don't, it's fine with me. But we would like to, maybe we can do the back entrance, because there is a stairway that goes upstairs.
Yeah.
We could go in that way, you're not accessing the resident care area. So we could probably do that. I'll talk to the director of nursing and see if that'd be fine. I don't know how we would do live though.
I have to bring a laptop and a webcam with me and set up, kind of like we did at the VAC. Be a little different, but we would have to do it that way. Which it's not a big deal.
Well, and I don't mind coming here, maybe we'll just, once we have the artwork done, we can have one at our place, so everybody can see it, and we can just come back here. That's fine.
You guys.
Whatever you want to do.
Like to get back to.
I'm getting comfortable up here now. I just don't want, residents, families going through this, everything, and we're sneaking in the back now.
Yeah.
I just wanna make sure everything's.
Oh, absolutely,
Yeah.
yeah. No, and it wouldn't be sneaking in the back, there's an entrance that does not access downstairs. So it's going up the front steps, straight upstairs and leaving. You wouldn't access any resident areas.
Yeah, so there's that side door,
Yeah.
you can go in and right up the steps.
Yeah, I'll ask if that's closure.
I guess sneaking wasn't the right word.
Well, I mean, we should be treated the same as
Exactly,
family members.
Yes, absolutely.
suppose we should have a motion to do this 3-year maintenance program for 10,000 on the boiler, so it's in writing. And you'll get that contract from, is that gonna be through John's?
It's Cintas.
The boiler?
I'm sorry, I'm thinking of the filer.
The boiler, I think
Yes,
John's does the
yes.
maintenance on that, correct?
Yes, I'm thinking of the filer.
Okay, we need a motion to accept that.
So moved.
Second, Elmer, all in favor? Opposed, motion carries. And then on the fire system, we need to get that taken care of with Cintas for 4612, 4588, that's through the sprinkler heads.
No, Cintas did fire.
Yeah,
Well, you changed companies, didn't you have somebody else before?
we did, and there were some issues with the other company, so we went to Cintas.
Well, it's fine, I just thought they were just uniform and Cintas.
Okay, we need a motion to accept that bid to Elmer, Kathy.
What am I seconding
Bid for the fire system to bring it back up to date after a 20-year inspection.
here? Oh, that one, sure, okay.
Okay, all in favor?
Aye.
Opposed, motion carries. Okay, we got the room rate, and then we need a motion to accept the food contract to send the full board. That's all been approved by our attorneys, it looks like. And we'll go to full board in October.
Yep.
Hey, who wants to make, you guys remember what the amount was? It's on here. This is a 1-year contract or a 3-year contract?
Which are we talking about?
The food service.
I think it's 1 year, then it renews.
And then we can renew it for the second and third year.
Yes.
That's what I was thinking.
We only got one bid on that?
The second time around, yes.
Second time around.
First time there was like 3, right?
No, the first time there was one bid.
Okay.
But it wasn't correct, right?
Well, they didn't include some of the things that we'd asked for,
And there's a lot more too.
so then we went back, and there was 3 that did the
WebEx.
WebEx, but only one sent a bid up, and that's the same food service that we have now. I don't know why you go through the WebEx, you wouldn't, unless they decide or something they didn't wanna deal with, or.
Maybe it's a staff lunch, I'm not sure. That seemed to be the problem with the first one. And the first one didn't come back, so maybe that's a problem.
Okay, so I need a motion to accept and forward that to the full board. Kathy, Elmer, all in favor?
Aye.
Opposed, motion carries. Okay.
Mr. Elmer.
Financial part.
We were ahead this month, which was a good feeling this time.
New staffing agency?
New agency, yeah. So we have, I think there's 3 new ones, but they haven't provided us anything yet.
They don't have the help either.
They said it's nationwide, but they're working on it, and we just got them, so we're gonna give them a little time, hopefully they can.
Now, are we gonna be forced to make our employees be vaccinated?
Not yet. So right now, they can get tested weekly. And then it looks like we're gonna go to bi-weekly testing. It looks like the IDPH is gonna come to that. But so far, they have not said, which this is CMS, they have not said, yes, you have to. Once Medicare and Medicaid funding is at risk, and they say you'll lose your funding, you'll have to.
Well, that's what I didn't know. It sounded like federal government was trying to mandate all government employees, and they were trying to make it that private employers had to follow the same regulations. And I didn't know if we were gonna be forced into it.
I see it coming, it just hasn't happened yet.
What percent of our employees are vaccinated?
I have to say, almost all but one of our union people are vaccinated. Our issue are non-union members. Probably, there's been 5 or 6 that's gotten vaccinated, so I can't tell you right now. I mean, the majority of people are vaccinated. I think we're 50 or 60% vaccinated, but the rest are non-union members. And they've said, I mean, they put in their religious exemptions or medical, but they'll quit.
Well, that's what you're hearing all over the country. A lot of these hospitals are having,
New York,
they're,
yeah, it's scary. But fortunately, our nursing staff mostly is vaccinated. And that's what would really scare me if we lost our nursing staff, then what would we have? Because that's the brunt of our work there. So, fortunately, we're good there. And agencies too, they're asking, do we need to be vaccinated? Do we need to find people who are vaccinated? So they're helping us there too. It's an issue everywhere. But I really feel like if we don't increase their wages, they're gonna start going to other places. We've lost people. We're not, like I said, we're down to 8 CNAs. When you have 4 or 5 on day shift, 1 to 2 on afternoons, and then 1 to 2 on midnights, that's all of our staff. And they're running themselves ragged. Our management's working the weekends. We're getting the agency what we can. The prices are not cheap for an agency either, so it makes more sense to pay our staff a little more. Then we can start getting other people come in. I already talked to the union as well. I had a meeting
we
with
need
them.
to go in executive session to discuss.
If she wants to go any farther, yes. I have to go get everything, if that's what you want to do.
Do what? I can't hear you.
I didn't know if we need to go into executive session to,
If you want to discuss more in more detail in regards to the topic you're referring to, we have to go into executive session.
Even if it's without names, it's just basically the
Yes.
shift. Yeah.
yeah,
I think we should.
yes.
Yes.
All right, we have to give me a minute to get
Okay.
Carrie, you were saying October looks good for admissions.
Yeah, it looks like we have quite a few inquiries for.
I see that here, but you think, then again, we're gonna have staff.
That's the thing. As long as our agencies pull through and can give us some more, then yes. And that's, because we're not getting people in, that's what I have to bank on now, is agency giving us some people. The one on Friday said they think they have someone who's available to work for us for 6 weeks. They'll come and work for 6 weeks. That's great, that's another afternoon. We can start increasing as soon as we have enough staff. But then when I saw the ad in the paper for Heritage, offering 19.
Oh. Now, does this All-American agency, they charge less than Grade 3 or?
All-American we've had,
Okay.
but I don't know, I didn't look into them. In fact, we've had them for a long time, but they weren't providing. So, my scheduler, she's like, well, should I try calling them? Because we just haven't called them. I said, yes, call everybody.
Yeah,
So I don't know off the top of my head.
just who we can get,
Yeah,
it's just who we can get.
exactly. 'Cause we have regulations we have to abide by.
Yeah. I'm sure you have like a staffing formula that Medicaid provides, you have to follow.
Yeah.
And we can't increase our census without adequate staff.
And we're putting in what we can care for.
Yeah,
and it's getting pushy with only 8 CNAs. So we'll have to do something. And with this pandemic, we don't know how long this pandemic is
Yeah, I'll
gonna
take
go
some.
on.
The winter's coming.
Yes.
How's harvest coming along?
We got about
But I'm
four
confident
fields
we
of
have,
beans, yeah.
we have the people out there that
We
want
got a
to
good
come
start
in.
on the corn.
So I'm confident if we could get more to come in,
Maybe.
the census is gonna go up,
Yeah,
for sure.
Well,
We just need to bring them in.
well,
three.
I just recently retired from Advocate,
One day we were
and
over
they
there
put in,
across
at
the
the end of
road.
August,
We got
mandatory
30
vaccination,
loads in the ranch.
or there's the goal.
Trees right
Really, yes.
Really?
And we lost
24
quite a
miles
few,
around.
nurses
Like
and
40 miles in it.
MAs, you know,
And we got 30
so,
loads.
Wow.
yeah, and
Oh, we had two water wagons.
Northwestern
They
the
got
same.
that. They got a
So,
load for it.
I see it coming like all healthcare.
Don't stop it at
You know,
Jerry's, huh?
healthcare, you get vaccinated,
No.
Yes.
or whatever, but, yeah.
They're not open.
It's
Okay,
scary.
right in.
Can we get a motion to go into executive session for 5 ILCS 120/2C1 employment, appointment, compensation, discipline, performance, dismissal of specific employees of the county?
I'll second
Roll call?
Roll call, Small,
Yes.
Corretto is absent, Owens,
Yes,
Lee,
it. Yes.
Cassip is absent, Walter,
Yes.
and Ron Blue is absent. Okay, Elmer, will you please shut the door? Oh. Thank you so much. Let me get out of here too.